to the Young Indian Professionals of New England talk show series with the professionals, where we highlight accomplished individual success stories and have our viewers get inspired and motivated to excel in their own professional journeys. Today we have Dr. Vaishali Sanchorawala, is a professor of medicine and director of the Amyloidosis Center of Boston University School of Medicine and Boston Medical Center. Thank you for being part of the show today.
So I'm humbled and deeply grateful for this opportunity, Niharika, and I welcome you all to this podcast, the show, and hope I can inspire young Indian professionals to be in healthcare industry.
Oh, thank you. So could you please share your professional success story and let our young professionals know how you got to where you are today at such a young age?
So before I begin about my success story, I would like to inform everybody about this rare disease called amyloidosis. Amyloidosis is a protein misfolding disease in which normally helpful proteins no longer serve their purpose or function. Different types of soluble proteins, which are normally present in our body, misfold and unfold, forming amyloid fibrils. These fibrils are then deposited in various organs, vital organs, and frequently lead to organ dysfunction, organ failure, and death. The limited knowledge surrounding amyloidosis stems from its classification as a rare disease, which is a condition that affects fewer than 200,000 people. Since this definition was created in 1983, rare diseases became known as orphan diseases, as pharmaceutical companies were not really interested in adopting them for drug development. So despite these challenges and sadness with deaths while dealing with this rare and life-threatening disease, there is a sense of hope, optimism, and at times real joy as I walk through the clinic in Mokley 3rd floor or the research lab in Conti 5. Leaving a lasting impact on the life of a person with this rare disease is what I strive to achieve. And that is what my career is all about.
Wow, that's amazing. And that's super rare. And I think everyone, especially young Indian professionals, should know about this disease as well. So that's amazing. So
thank you.
What was your professional success story and how did you get to finding out about this disease?
So, I was at the right time at the right place, maybe wrong time at the right place, or maybe right time at the wrong place. I don't really know. But this was July 1st, 1994, when I started as a fellow. There was a patient suffering from this disease who was from New Jersey, who had come to Boston for treatment of this condition, because Boston University is a globally recognized, internationally reputed a center for amyloidosis treatment and research. And this patient had traveled all the way from New Jersey to undergo treatment for this rare disease. And I had moved from New Jersey to Boston, Massachusetts as a fellow in training, and there was this connection of being from New Jersey. And, I found the disease very fascinating because it can involve all organs in your body, and it arises from the bone marrow. That is where the connection of the hematology is. And, the treatment is related to chemotherapy. So it was all fitting together. I really, really felt that, I could make a difference. It was a rare disease, and I really felt very attached to this patient. And that, really started out my journey. And then I got involved in multiple research projects, multiple clinical trials, and, that was 20 years ago, and rest is history now.
That's amazing. And that's very impressive that you wanted to focus all your life because of this rare disease. That's really impressive and very motivating.
Thank you.
So is there any specific study in the field of clinical research that you found most interesting and memorable from your journey with this disease?
So I think the clinical studies that I have really conducted are really developing clinical trials with novel therapies to really make an impact in this disease. And I have conducted many clinical trials. Actually, I was just writing a paper about this, and the clinical I have conducted about 30 clinical trials in my entire career, and have enrolled about 350 patients with amyloidosis on these clinical trials. And this is what really makes my career worthwhile, is developing and performing clinical trials, enrolling patients, and giving them a hope with novel treatment agents. The clinical trial that is really memorable is Andromeda clinical trial, which was a clinical trial, which was a randomized phase 3 clinical trial of standard therapy versus standard therapy with a monoclonal antibody. And that clinical trial was performed globally. And in this rare disease, it had a really huge impact on the outcomes for patients. And this led to approval of this standard of care treatment plus monoclonal antibody by the regulatory agencies, EMA in Europe as well as FDA in the US. So now this is the standard of care. It was published in the New England Journal of Medicine, and this has really changed. It has been a game changer for this disease. And I think one thing that I would like folks to note is that 90% of patients who are enrolled on clinical trials are whites, and only 7 to 10% are of racial and ethnic minorities. And I think we need to do better. We need, as a community, as a society, we need to do better in offering these innovative trials to provide access for novel treatments to marginalized patients. And, I think that is what I strive to do, that I really want, everybody who are marginalized because of their socioeconomic status, because of their race, because of their ethnicity, should be offered clinical trials with novel agents that they should be able to participate and get benefit from.
That's amazing. Yeah, I feel like me being having a background in clinical research, I know how much hard work it takes to get your study to where it is today. So the fact that it was published on that very reputable source was amazing. And I do agree with that. We need more people with color and more women to be part of this research as well, because that's something groundbreaking as well. And I feel like even with the union community, I feel like if we put our voices into the healthcare sector, that would make our community even more better and would be able to promote healthcare issues also in our community and nationwide too. So I think that's, you bring up a really great point. So I know with clinical research, there's a lot of struggles, especially when it's getting approved by IRB, NIH, etc. Did you encounter any obstacles as a clinical researcher, and how did you overcome them?
So Niharika, as you said, clinical research has many challenges. And to just name a few, there are ethical considerations. There is recruitment and enrollment. There's funding and resources, study design complexities, data management, data analysis, and then publication. So overcoming challenges of clinical research in a rare disease like amyloidosis, it requires a lot of effort, and it requires careful planning, collaboration with multidisciplinary teams, obviously adherence to ethical guidelines, and also proactive approach to problem solving. It also requires negotiations and meetings with the regulatory agencies, because some of the endpoints of these clinical trials are not validated since this is a rare disease. So we've had multiple meetings with the regulatory agencies, specifically the FDA, called Amyloidosis Forum, which is a public-private partnership with academicians, with nonprofit organizations, with patient organizations, and the FDA to come up with clinical endpoints for clinical trials, for validation, for novel endpoints for clinical trials, and what would FDA accept for clinical trials that would lead to approval of these novel agents in treatments for amyloidosis.
Yeah, no, I understand that. I know with my group that I was part of, we would be doing all these IRB things and all these clinical ethical considerations that was going on, and those can be hefty. So it takes a true leader to step up and find innovative problem solving, as you mentioned, which it would be very applicable to other industries as well too. So I know that AI and artificial intelligence is coming up to today's culture today. What do you think about AI in the clinical research field?
So I think, it is that AI has a great potential in medicine, but it is not intended to replace healthcare professionals like me or you, Niharika, for that matter. Rather, AI can complement our expertise, assist in decision making, and maybe even improve patient outcomes. So I think the integration of artificial intelligence into medicine requires careful validation, I think obviously ethical considerations, and I think ongoing collaboration between the AI experts and healthcare professionals to ensure that it has safe and effective implementation. So for
Exactly.
example, for amyloidosis, since it's a rare disease, we are developing some AI models to diagnose amyloidosis earlier in the course of the disease in the patient's journey with the help of AI models. And we have developed AI models based on echocardiography features, ECG features, to see if patients with amyloidosis can be diagnosed early, or at least the red flag is raised that this patient should be suspected to have amyloidosis. We are trying to develop some algorithms that would also raise this red flags for healthcare professionals to consider the diagnosis of amyloidosis.
Yeah, no, I think AI is definitely helpful when in terms of like writing grants or writing proposals for research, but obviously AI is not catered towards getting the correct information. So that's when we humans have to come in and read to see if all the information is correct. I know that in BI in Beth Israel, we already started having robots that do surgeries, and to me that's very scary because I don't know like how correct they are and how they can see and detect like bodies and other parts of the body that is very like rare as well too. So I mean it's definitely scary, but I know AI will definitely be useful in some parts of healthcare, but obviously we still need humans to take us to the right direction, because that we will be able to provide this correct information for patients and for the community.
I think it's going to be very complementary.
Exactly.
And I think it will assist in definitely decision making, and it creates very good algorithms, for healthcare providers to really follow those algorithms to reach to the conclusion and the decisions.
Exactly. Yeah, very true. So I'm gonna take this question to more in the South Asian aspect of things, but I know mental health is a very important topic in the South Asian youth culture. So how can we promote mental health treatments and educate the youth in the Indian community today?
So I think it is, mental health is a big problem. And I think the solutions need to be implemented in a very holistic and integrated manner. We have to consider the intersectionality of factors such as culture, identity, socioeconomic status, and specifically in our community, the family dynamics. By combining these targeted strategies of awareness, community involvement, and accessibility to support services, I think it is very, very possible to promote positive mental health outcomes for South Asian youth. I think that, again, I think that with COVID, we have recognized that support services are not that easily accessible. And I think having accessibility for support services and also awareness, I think, is critical. I think family dynamics is one of the things that is important to recognize, because that it was considered as a stigma in Indian community to have mental health issues, and which obviously is not the case, and it needs to be recognized and it needs to be treated.
Very true. I think you brought up a really great point about that. So I know healthcare industry requires long working hours on weekends and weekdays. How do you maintain a balance between your professional and personal life at the same time in being successful?
I'm a unapologetic workaholic. So I think for me, there is no work-life balance, but I think I think achieving work-life balance is an ongoing process, and it requires periodic adjustments to accommodate changing circumstances, maternity leave, when your, child is not well, when there's functions happening at school. So, you have to be able to accommodate all these changing circumstances. It's also essential to be proactive in prioritizing your own well-being and also seeking support when needed. It's okay to ask neighbor for help. It is okay to ask a friend for help. It is, you are not going to be able to do everything on your own. And I think by taking care of yourself, you can better serve your family, patients, and have a more fulfilling personal life. So I think it is very, very critical that we understand that you are not alone in it. You have help, and it is okay to ask for help.
That's very true. And I think every working professional should understand and know about that aspect too, that it's okay to have a good work-life balance as well too. And that'll promote a very good positive productivity in the workspace as well too. So I know that you are also have a great interest in your charity organization called Cradles to Crayons. Could you tell us about that and let the young professionals know what that does?
So, I work for several charity organizations, and, I always tell my family that those are the best days when I spend time at Cradles to Crayons or at Core Unam, which is a meal shelter in Lawrence. Now, Cradles to Crayons, it provides a nonprofit organization, and it provides children from birth through age 12 living in homeless or low-income situations with the essential items that they need to thrive, either at home or at school and at play. This nonprofit organization supplies these items free of charge by engaging and connecting communities. So I volunteer at this organization, and we are sorting all these different essential items that are needed for children for either at home. So it could be clothes, it could be food items, it could be school supplies, it could be toys, it could be board games, it could be, so we go there. I go there once every few weeks, and there's a lot of sorting that we end up doing. We package them in care packages, and then these are delivered to the children who are homeless or are in shelter or who are from low income situations. And the other place that I go to work is at Core Unam, which is a meal shelter in Lawrence. And I volunteer there on Saturday mornings, where we make a food for about 200 to 300 people who from Lawrence area who come there to eat dinner. So we make dinner for these folks, and it's a beautiful facility. And, I'm really, really very, very proud to be, able to provide my time to, provide good meals for these individuals.
That's amazing. And if any of you young Indian professionals want to be part of those organizations, definitely reach out to Dr. Sanchorawala for more information and be part of this noble cause. So just to talk in a generic sense, what motivates you to achieve more incredible things in your professional life?
So I think that my biggest motivation is to make a positive impact, whether it's through my work, whether it is through my research, through advocacy that I do at the FDA, or by community involvement. So making a positive impact is what motivates me the most. And that is what motivates me in my personal life. That is what motivates me in my professional life.
That motivates me too. We all want to create a positive work environment and also a social environment too. So I definitely do agree with that. So what qualities do you think professionals should have to succeed, especially focusing on healthcare industry?
Oh my, that's a tough question. There are many qualities that come to mind, and I think pursue your passion. So you have to have a passion, and you have to pursue your passion. Don't give up. Embrace continuous learning. Build a strong network, like we are doing through what Niharika is doing for the young professionals. Seek feedback from your mentors, seek feedback from your teachers, and embrace constructive criticism. You're not seeking feedback just because you want to be praised. You want to know the constructive criticism, and you should be able to embrace that. Embrace any challenges. Take calculated risks. Maintain a very good work-life balance. Foster very effective written and verbal communication skills. Cultivate resilience. Resilience is the name of the game in this world. And I would say stay proactive, by creating these networks, by creating your own little world where you can rely on your friends, where you can rely on your professionals, where you can rely on your professional colleagues. And I think that is what really, really are good qualities to have to succeed in any profession, not just the healthcare industry.
Very true. So on that note, do you have any last advice you would like to give to the young Indian professionals of New England?
Right. So, the last advice is just enjoy the journey. Remember to enjoy the process, celebrate milestones, embrace experiences, make connections, and personal growth that come with your professional journey. So I think that is very important, and work-life balance and mental health are two critical other things that I would like the young Indian professionals to know, that support services are available, and you should definitely seek those when needed.
Yeah, I think that's great advice. And that's why I created this organization to promote networking, not just in the workspace, but also in the community sense as well, and especially in the Indian culture. So I think what you said was really true. And hopefully you all take advantage of this organization or take advantage of networking in the workspace as well. I think growing connections is definitely useful, especially in today's culture. So thank you so much for being part of the show today. It was a great pleasure to have you.
No, thank you so much. And I'm really, really profoundly pleased and deeply grateful to be on the show. I remain available if anybody has any questions regarding this rare disease of amyloidosis, healthcare, healthcare sciences, research opportunities. I remain available. So just seek us, find me. I'm on internet. I'm on, our website. I'm on social media. Just find me.
Perfect. And I'll be putting her social media in the description as well for the video. So thank you so much and have a great rest of your day.
Thank you. You too. Thank you.